The things we do every day are not often done just in the anatomical position. This video will show how the movements you learned look different when we are in different positions. Before we do that, here's how you name movements at the joints for when you're keeping your records later. Name the side of the body of the person, the joint, and the movement. For example, this is right ankle dorsiflexion. Or, this is neck rotation left. Neck. Neck flexion. Neck extension. Neck rotation right. Neck rotation left. Neck side flexion right. Neck side flexion left. Shoulder. Shoulder flexion. Shoulder extension. Shoulder abduction. Shoulder adduction. Shoulder external rotation. Shoulder internal rotation. Shoulder external rotation. Shoulder internal rotation. Shoulder external rotation. Shoulder internal rotation. Elbow. Elbow flexion. Elbow extension. Pronation. Supination. Pronation. Supination. Wrist. Wrist flexion. Wrist extension. Wrist ulnar deviation. Wrist radial deviation. Wrist flexion. Wrist extension. Wrist ulnar deviation. Wrist radial deviation. Fingers. Finger flexion. Finger extension. Finger abduction. Finger adduction. Back. Back flexion. Back extension. Back rotation left. Back rotation right. Back side flexion left. Back side flexion right. Hip. Right hip flexion. Right hip extension. Right hip abduction, right hip adduction, right hip internal rotation, right hip external rotation, right hip flexion, right hip extension, right hip abduction, right hip adduction, right hip external rotation, right hip internal rotation. Knee, right knee flexion, right knee extension, right knee flexion, right knee extension, knee flexion, knee extension. Ankle, right ankle dorsiflexion, right ankle plantar flexion, right ankle inversion, right ankle eversion, ankle dorsiflexion, ankle plantar flexion, ankle eversion, ankle inversion. This has been a review of the names of the movements at the joints from two different angles and different positions. This video is not intended to be medical advice and should not be used as a substitute for professional diagnosis or treatment. The content is for informational and educational purposes only and is specifically presented for review by individuals already trained by Therapy Clinics International. Always consult with a qualified healthcare provider regarding any medical conditions or healthcare concerns.